The following program is a Town of Colonie television production of the William K. Sanford Town Library.
Welcome to Mental Health Now. I'm your host, Matthew Shapiro from the National Alliance on Mental Illness, New York State. Before we start today's episode, I want to remind everyone that NAMI will be holding our NAMI walks on September 24th at the Jennings Landing in Albany. We're thrilled to announce that NFL Super Bowl champion Keith O'Neill will be serving as the Grand Marshal for the walk. And he will also be our guest on the next episode to tell his inspiring story. For more information about the walk, please visit our website, www.NAMI-NYS.org, or you can visit us throughout the month at Colonie Center, where we'll be having an informational kiosk. I'm very excited about today's episode as we're going to be discussing one of my favorite topics, the need for mental health reform. I'm extremely honored to be joined by our Congressman here in New York's 20th District, Paul Tonko. Representative Tonko has long been an advocate for improving the lives of individuals and families impacted by mental illness and has been a long champion for the need for insurance parity, going back to his time in the New York State Assembly. For his efforts, NAMI-New York State awarded Congressman Tonko our 2011 Legislative Champion Award, and I'm thrilled to have you as a guest today.
Thank you, Matthew. It's great to join you.
So let's start. Recently, mental health advocates celebrated the passage of H.R. 2646, the Helping Families in Mental Health Crisis Act. In many ways, this is the most comprehensive bill to overhaul the mental health system that the House has ever passed. And as always, you were very involved in the process. You serve on the Energy and Commerce Committee where the bill was first introduced. And language of the bill that you authored, the Coordinating Crisis Care Act, was included in the bill as well. And you spoke very passionately on the House floor for it, which we appreciate. So can you explain to our viewers what excites you about the bill and how it will help the 1 in 4 families impacted by mental illness?
Sure, thank you. And that stat alone is a reminder that this was long overdue. 1 in 4 families being affected by mental illness, mental health disorders. It's important for us to recognize that there's still unfinished business. While not perfect, it was a move in the right direction. And there were things that I really wanted to see part of the bill, but you're right, the efforts for the Crisis Act that I was promoting included language for a bed registry.
Right.
You know, when we have these crises, there needs to be this collaborative and coordinated concept that allows people to reach to all the solutions so that they can have the best response to the person in need. So a registry for beds, I think, is an important part of it. That was part of legislation that we had long championed. And also having adjustments made in and sensitivity factors addressed for police forces, for instance, so that they're part of that whole thing. And then we added a piece on adult suicide prevention. The growth of 25 plus in the adult community has been the most significant, and we wanted to make certain that that was part of the overall construct of the bill. But 2646 is something that I supported. We had a few negative votes in the House.
Just two.
Two, right? And it goes now to the United States Senate. But again, there was nothing that was harmful, I believe, in the bill, and there are some things that are left unaddressed and some unfinished business that others were championing that we'll get to. Right. But I thought, well, here's a good base from which to start the reform effort.
Certainly, and it was, I think, one of the biggest first steps we've taken quite some time. And just to a little further on the bill we were talking about, the Coordination Act, it would actually create a registry through SAMHSA, the Substance Abuse and Mental Health Agency, which is great because a lot of times in a crisis, a family doesn't know where to turn to, or a person living with a mental illness doesn't know where to turn. And that's also, like you said, for mental health and substance abuse issues and addiction issues.
Which I thought was important because we need to see the addiction crisis, especially in the heroin area, as an illness. People will want to point a finger and blame or judge. I think what we need to address is understanding it's an illness and, research that hopefully will come with the 21st Century Cures Act with $8 billion set aside for research. I think that the Research for the Brain initiative that the President has implored Congress to utilize is important. When we think about it, the brain is the least researched organ, and that should startle all of us because it could open potential for everything from Alzheimer's over to mental illness, mental health disorders, and addiction.
Yeah. We're actually very excited about the Precision Medicine Act ourselves. We're actually the outreach partner for the National Institute of Mental Health. There was a great article in the New York Times last week about the 10-year study that they're doing. A lot of it will be here in New York, downstate in Columbia University, and others are going to track people for 10 years and all their habits to try to get an idea of what causes different diseases. So that's very exciting. Of course, the research on the brain and the Brain Initiative is much needed too. And HR 2646 does fund a lot of new research. So that's very exciting. But
I think that's an important element of 2646.
Definitely, certainly, it's one of the things we say a lot of times. Research is our hope for the future. So it's something we're definitely excited about. But as we discussed, there still is a lot of work to do. And of course, the next big step is getting the Senate to pass one of the bills that's its companion piece, which right now is Senate Bill 2680, which Senator Gillibrand's a sponsor of, and we're hoping Senator Schumer will sign on. It's got very broad co-sponsorship in both parties. But unfortunately, some leaders in the Senate are trying to tie it to gun control, which we believe is wrong.
And I would agree with that assessment. We're trying to float this boat, so to speak, through a sea of thinking that is all about cost cutting, that government's a problem, government's the enemy. So I think the progress we made with 2646 is substantial because of the tone that's out there with on the Hill in Washington. But the rationale coming from the Senate is that this is part of a package for gun reform, gun violence prevention. I think we walk a terrible route there when we do that. We need to look at the stats, and people living with mental illness or mental health disorders are much more targeted by gun violence than they are the perpetrator. They have been victimized many times over, 11 times more likely that you're impacted by gun violence, and I think 5 times the murder rate of individuals with mental illness being victimized. So we should see that for what it is. I think it's an easy route for people in Washington, legislators, representatives, to say, it's the mentally ill. No, I think that's a discrediting, a misrepresentation, a characterization that is false. And we need to remind ourselves of that and not fall into that trap. What we need is common sense, gun violence prevention reform. I was part of a sit-in in the House and very proud of that. It was led by John Lewis, Brother John, as I refer to him, who, got America to think soundly and with laser sharp focus on what the issues are and what the common sense factor is about.
And one of the exciting things too, we are seeing leaders in both parties actually working together on mental illness, but even saying that they are separate issues. Senator Alexander has said that mental health and gun violence and gun control are separate, as did the sponsor of HR 2646, Representative Murphy from Pennsylvania, a Republican, said we need to separate those issues out and to see them tied in. So hopefully,
and I believe Senator Murphy from Connecticut is also of the same thinking.
Correct.
So, it's good that these forces in a bipartisan way are expressing that, for those of us who care about sound mental health policy, public policy, we're recognizing and stating clearly and emphatically, you don't make this the all-in-all solution to gun violence prevention.
And one of the exciting things for us, too, because we talk about this all the time, is that mental health reform shouldn't be a political issue. It should be something we should all support, and to see Republicans and Democrats working together is very inspiring. Like I said, on the Senate bill, it's basically split down the middle in co-sponsorships between Democrats and Republicans. And even watching Vice President candidate Tim Kaine's interview at 60 Minutes, he cited mental health as one issue that Democrats and Republicans should work together on, or can work together on. So
Wouldn't that be wonderful?
yes, that's what we're hoping, and that's why during this campaign season we tell all our members to speak to members of both parties about mental health, and
acknowledge too that our domestic investment in the federal budget is not being expressed fairly. Everyone wants to think it's this bloated investment in domestic areas, and it's not.
Right.
We will pay for war and bloat the budget that way, but truth be told, we need to invest in certain areas of mental health, prime amongst them.
Right. It's actually a very sound investment, because proactively investing in mental health services before people get to that crisis level where they enter emergency rooms, long-term psychiatric care, in the worst cases into the criminal justice system, getting it on that end is a lot more expensive. So these investments on the front end
absolutely,
are really
and
crucial.
the services provided, the interactive community services, the youth, the emphasis on youth and reaching out to them. These factors within the bill are important. And one of the things we did not accomplish was a bill that I've been working on with some of my colleagues, including Representative Kennedy, and that is 4276, which is requiring that we review the parity issue. Having championed parity in New York, I believe that was the first state in the country. We preceded the feds with parity, and it's something that's very important to fairness out there and appropriate investment. And I just prided myself on championing that issue in New York. 4276 would have us look with much more scrutiny at how parity is working or not working.
Again, when we talk about parity, we're talking about insurance companies covering mental health psychiatric diseases the same way they would cover any other physical disease.
Exactly. And some of the stats are very telling. In Maryland, for instance, 14% of psychiatrists were taking on new client load. We find that the denial rate is double for mental health denials, claim denials, than they are for general health. And some of the pharmaceutical issues are very telling, with very weak funding. So this parity requirement, making the insurance companies disclose how many denials and what the logic was.
Right.
I think that captured in HR 4276 is a good step of going forward. We couldn't get that done in this bill, and I won't go into those reasons because I'll get more and more angry. But we know where the deep pockets lie, and we know where the pressure comes to not do things. And when we're doing sound reform, let's be real.
Right.
Let's be there so that we can truly invest in the programming that is required for those who live with mental illness. And to your point, Matthew, about bipartisan as an issue, 1 in 4 is a frightening statistic. It's got to cover both last initials.
Right, and of course, and we say it's too that it's 1 in 4 people with a mental illness, but everyone's going to have a mental health issue at some point in their life, be it it's depression, grief, stress, anxiety, and people need to know when they have those type of issues that help is there, and it will be covered. More importantly,
and with the concern for cost crunching, if my colleagues share that concern with me, as I'm certain they do, it shouldn't be a rationale to deny the investments. You should look at the preventative elements that will reduce the additional spending that would be required into the future. If we can get these cases early and make certain we deal with them in a preventative way, and that's why I'm so interested in this parity thing. I want to see these, the young people or those first impacted with a chronic illness, having that addressed as well as we can.
Right, and it's interesting for you because it is a very personal issue. It's actually, we were so ahead of the ball on this, but it was really for a constituent of yours when you were representing Amsterdam in the Assembly with Timothy's Law and Timothy O'Clair. Do you want to tell that story a little bit?
Well, his family was absolutely devoted to this effort for parity. And, I had known Timothy as a young little leaguer. And, bright-eyed, and I'm certain he had many, many wonderful dreams, as all of our children have. And he was impacted by triple diagnoses. And when he was under the cap for outpatient, inpatient services, Timothy did well. And when he reached that cap, that's when he would, erode a bit with the quality of health. Tragically, Timothy lost his battle. He completed suicide, as his parents have taught me to say. And you know, it's a very painful journey. You know, they came to us, and I said, you know, I pledge to you, I will do everything within my intellect, my energy, and my ability to get this mental health parity issue across the finish line. And I would say to my colleagues in both the Senate and the Assembly, look, the Eau Claire family has come forth, and they're asking us to open our door so they can open their hearts and share their message. Theirs is a tougher journey. And it angered me when some people wouldn't open that door. And I got the sense that if I know this, if I'm made aware of what needs to be done, then I have this awesome responsibility to respond. And that sort of denial, self-imposed, is unacceptable. But it was a long journey, several years, and we finally got there. And celebrated with the Eau Claire family. And I remember standing on the steps to the entrance of the Assembly, just celebrating in huge victory. And, you know, it took a long time. Some politics got twisted in there, I'm not ashamed to say, and we put pressure in a political way for a substantive reason and for a moral concern. You know, this is, I think the human aspect to this one was much warranted and very justified.
And one other issue.
And Timothy's a champion, so he's up there, you know, applauding.
And actually, his father is someone we work well with a lot with, Tom O'Clair, and he's actually going to be leading a suicide prevention workshop at our upcoming conference. So we're so lucky to have him as part of our movement still, and making sure other families don't experience what his family did. You know, another big insurance issue, I just want a quick comment on this. We were actually, it was very humbling today. We participated in front of the Capitol with a broad coalition of health advocates urging Governor Cuomo to sign legislation, Assembly Bill 2834, that would regulate step therapy, where insurance companies don't give medication that a doctor provides. They use a cheaper option and force a patient to fail first. And this is a bill to regulate that, giving doctors more of an oversight on that, and it passed both houses unanimously, which is very exciting. So we do urge our viewers to call the governor's office at 494-8390 to urge him to pass A 2834.
Well, yeah, and I know there have been many reforms and many adjustments in the healthcare insurance debate and outcomes, but all in all, let the doctor be the agent of wellness here, and you know, it shouldn't be dictated by an insurance company. It should be the MD, the clinicians, the healthcare professionals who determine the appropriate route. And you know, any improvements, anything keeping in the spirit of HR 4276 is fine by me. So I wish you well with that effort.
Thank you.
And we'll make our voices heard in that effort too.
Awesome. And one issue, now I want to get an issue which is a little more complicated that didn't really get addressed in 2646, and that's the Medicaid Institutions for Mental Health, Mental Disease Exclusion, which prohibits federal Medicaid money financing for care for patients in mental health and substance abuse residential treatments larger than 16 beds. Now, obviously, when this was introduced by President Kennedy, it was very well intentioned. He was trying to break up the asylums that you know, warehouse people under terrible conditions. But a lot of people do need that type of care, and under the IMD exclusion, which NAMI thinks is one of the few discriminatory laws still on the books, people can only get 180 lifetime days. So
for the Medicaid, for the Medicaid,
yeah,
right. And you know, I think we need to take that back a bit. You know, because we've gone through so many reforms. If you were to structure a healthcare coverage concept today, you know, logically you would put in some assistance where institutional stay may be required. You know, and I think it defies logic to have this sort of bill still on the law still on the books. What I thought was missed by this effort was the waiver here that IMD stays at institutions should be covered for Medicaid purposes. You know, we want everyone, regardless of income strata, to realize the benefits of wellness and mental health recovery and response to their illness. What I hope is a good effort here. It was modified, a slight improvement in there. While I would have liked to seen the full loaf here, what we did include was working with the Medicaid and Medicare systems through HHS, where they will work with the states to enable them to work around this, blockade in the road, so to speak, blocking the road, and enable them to show where if they can incorporate that to an overall strategy, a comprehensive strategy, they can forego that piece of the law. I think that's helpful where states have initiated managed Medicaid, managed care in the Medicaid arena. And I think, putting the test to the states where they come up with this logical, comprehensive plan will be a good opportunity. But all in all, my goal was to make certain that IMD, Medicaid coverage, be provided and not be restricted by 180 days in a lifetime. When you think about it, that's pretty brutal. And it's not being real with those who require institutionalization.
And I think it's important to note that we talk about this all the time, that mental illness is such a broad spectrum. Even, NIMH talks about this a lot with the Brain Initiative, that even what we're calling schizophrenia today, 10 years from now might be 20 different diagnoses. So, some people, we hope people can recover in the community setting, but there are some people with the most serious and persistence who need that type of all-encompassing care, and it is a small percentage, but it's an important percentage, and we want to make sure that everyone gets appropriate care for their recovery.
Absolutely. And we also, in terms of fairness and justice, we wanted to make certain that the physical care coverage for those who are in those IMT situations have that coverage maintained. That's one improvement that came in the bill, where for children who entered these IMDs, their physical care coverage may not have continued. So now we've taken that disruptive piece of the law, that unfair piece, and made it equitable so that both mental and physical health care coverage for Medicaid eligibles in IMD settings will be available for children.
Yes, that's so important.
And we're also looking at the Medicare element of care in these institutionalized settings. And again, a 190-day threshold is unreal.
Especially talking about children,
And so that one we didn't get accomplished. That's one of the failures in the whole system. And Representative Bustani from Louisiana, a Republican, and I are working on a measure, and hopefully later this year we'll share our proposal and hopefully have coverage for Medicare eligible individuals. So there's enough work left undone, and I just enjoy the challenge, and I enjoy the partnership of the advocates in the mental health arena. All through Timothy's Law, in that discussion, I said I had never seen a more vigilant and resilient group than the mental health community. Being out there with candles burning at midnight, very peacefully requesting us to get Timothy's Law done. It just garnered such respect from myself and so many of my colleagues.
Well, it's interesting when you talk about the families impacted by mental illness, because we say this all the time at NAMI, that mental illness doesn't just impact the individual, it impacts the entire families. And, it's estimated that over 8 million Americans provide care to an adult living with a serious mental illness, and typically they provide 32 hours of care a week.
It's amazing, isn't it?
It is, and that's more than a part-time job. And we've made great strides here in New York with the Paid Family Leave Initiative, which would allow people time off from work without worrying about salary or job protection or losing their job, to care for people in an emergency, whether it be an emergency or that very intricate and important time when they come out of a facility and reintegrate into society, or in worse situations when families run away. So that was a great way that New York is leading the nation. Do you see something like a paid family leave being able to spread on the federal level?
I think it would be very helpful, and you hear a lot of it in this campaign, at least from some of the messaging, and we won't go any further. But paid medical family care, family leave is so important for family care situations, and yes, that would be one way to really assist people with these situations, and other situations like newborns having, enabled by their parents to have leave, which we've had situations within the office to speak of. But, I think that that whole effort is very important. The paid family leave and incentivizing the arena with new additional clinical and professional medical professional bodies. We just, to make this all work, to make the Affordable Care Act and Parity work, you need to have the strengtheners, and that comes through the human infrastructure. Some of the work we've done with OTs, with occupation therapists, has been very helpful, especially in underserved areas. Our rural areas need that assistance too. And I think, again, it goes back to parity, making certain that the resources are there, that the people's needs are addressed before they go well beyond what was avoidable. So I think, again, it comes to parity and making certain that we have good documentation of how many caseloads are rejected and for what reasons, and making certain that that then guides us. There was a bill, there was a part of administratively called for items by President Obama that got codified into the bill, and that includes the maintenance of statistics, because that statistical evidence is very important in the advocacy and the fine-tuning of just what other elements of reform are required. So I was happy that by executive order, the President called for statistical documentation for mental health and mental illness purposes, and that got codified in 2646.
One thing, and we're running out of time, I think we'll have to have you back soon, hopefully.
Yeah, this half hour goes quick.
It goes so quick. But I'd be remiss if I didn't mention that one of the big epidemics in our country is what we call criminalizing people with a mental illness. 2 million Americans with mental health conditions are currently incarcerated each year, mostly as a result of their illness and not getting the type of care before they hit a crisis mode. So obviously jails aren't designed to provide mental health care and to help people recover. So in your opinion, what can be done to reduce the incarceration of people with mental illness?
Well, I think, again, sensitivity in training of our law enforcement community is important. I think, again, preventative elements that need to be resourced to the appropriate level so that we can avoid some of these stays. And also just revamping our thinking. We don't just warehouse people. I would hope that there's this desire to have people leave stronger than when they entered. And to me, it's criminal to suggest to an incarcerated individual as she or he leaves and say, here's your medication for 7 days. No, there needs to be a tethering. If we're going to be smart about how we invest, I think it's cruel to the individual that's been incarcerated. And sometimes, just the system does not understand the mental illness or the effects of that mental illness. So alerting people, growing additional awareness, I think is important in the various elements of the system that deals with incarceration. But then again, tethering the person as the incarcerated soul leaves that institution with soundness of programming so that we're not causing additional misery and wasting dollars.
A big part of that, too, is presumed Medicaid eligibility upon discharge, which we've advocated for. Another one, too, is obviously the conditions in jail. And we were very excited that this year we passed legislation to reduce suicides within prisons by training correction officers a lot of the same way we would provide CIT training to police officers. One other issue, and we're glad the President has really led on this, is reforming the use of solitary confinement, especially for people with mental illness, and limiting that, trying to limit that.
And the President has been a champion in that regard, and I think it's, again, just how we see these pictures, these issues in a bigger framework, in a bigger picture. And when we do that, I think then we get sensitized with the appropriate public policy approach that makes things better and sounder, certainly better from a humanistic perspective from the individual who's struggling with mental illness, and certainly wiser for the impact on taxpayers.
And that really is all the time we have. Really did go by very quick. We look forward to having you as our guest again and talking about some of the more issues and hopefully more reforms we're able to make on the federal level. Well, again, we thank you so much for all your advocacy.
Matthew, my pleasure.
And we look forward, actually later this evening, we'll be participating in the Congress on the Corner event with Congressman Tonko, which is more of a mental health summit. So it'll be great to discuss these issues in more in-depth fashion. So thank you again for being our guest and for all the
pleasure.
work you've done.
My pleasure.
All
Thank
right.
you, and thank NAMI and all who have advocated so well.
And I'll leave you with one final note. Something we say a lot at the closing of the show is kind of our slogan, that hope starts with you, and you're certainly the epitome of that. So thank you, and we'll
Thank
see you
you.
next time on Mental Health Now.